Welcome back to the Doctor is in television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California, the central coast of California. Thank you very much for being here. What I'd like to do today in this short segment is to discuss the tired-looking eye, or tired-looking eyelids, or eyelid rejuvenation. Those all come under the same category of what people call the office with very frequently saying, "Doctor, my eyes look tired. I'm not tired. I have lots of energy, but it looks to me like my eyes look tired. Is there something we can do about it?" Well, I'm happy to report, I'm happy to tell you that there's a lot we can do about tired looking eyes. And what I'd like you to do is to be prepared so you can get the most out of your consultation that you schedule with my office for your tired looking eyes or eyelid rejuvenation. My advice to you is, if you're interested in any type of procedure to improve the periorbital region, what I mean by that is the region around the eyes, the periorbita, is to be able to look in a mirror or bring in photographs and point out what it is that you would like to change. When people say to me that they have tired looking eyes and they want to change that, everybody seems to have a different idea of what is making their eyes tired. It could be a low eyebrow, what we call brow ptosis. It could be perceived excess skin in the upper lid. People can tell that they've lost volume in the forehead and temples, and that allows for the brows to fall down, and it gives the sort of illusion that there's lots of extra eyelid skin, when typically there's actually a little bit of extra eyelid skin. People can have volume changes. Their upper eyelids can get puffy. And then, of course, when it comes to the lower eyelid, it's typically the pouches that people present with. There's something called a tear trough, or the eyelid-cheek junction. That's the junction between the eyelid and the cheek, that area that plastic surgeons call the tear trough, or the eyelid-cheek junction. It's desirable in an attractive face to have a smooth eyelid-cheek junction. And if you're going to have a prominent eyelid-cheek junction, in general, we like that to be high. If you were to walk down Alvarado Street or Fifth Avenue or Rodeo Drive in Beverly Hills and you look at beautiful mannequins, they represent kind of a cartoonish appearance of a very smooth eyelid cheek junction. And if you flip through the glamour magazines, you'll see very smooth eyelid cheek junction. In other words, that flow between the eyelid and the cheek is always very smooth. No one really has a eyelid cheek junction that's smooth. That's all airbrushed in the glamour magazines. But it's a good lesson for plastic surgeons and for patients to understand that when there's a prominent eyelid cheek junction, when there's a deep tear trough, when there are pigment changes, when there are dark circles, that gives the illusion of tired eyes or aged looking eyelids, etc. So the other issue that I'd like to point out is that the lateral canthal mechanism, there's a tendon towards the corner of the eye near the ear. It's on that side. What I call the medial canthus is toward the nose. The lateral canthus is towards the ear. That's the lateral canthal mechanism. That canthal mechanism can get lax and loose with time. We blink hundreds of thousands of times, probably in a week, and that canthal tendon can get lax, and it allows the lower eyelid to come down, and there can be something called increased scleral show. What that means is there's increased white showing between the lower eyelid and the cornea, or the iris, the pigmented part of the eye. The extra white can show, and then when that gets to be excessive, that leads to something called ectropion. That's where the lower eyelid actually fails to serve as a moisture barrier and serves to guard that conjunctival sulcus. When the lower eyelid pulls down or falls away from the eyeball, that's called ectropion. And the converse of that is entropion, where the actual lid can turn in. That's a kind of an unusual situation, but that can happen with a lax or tightened or scar or adherent lower eyelid. Now, there's another issue that I'd like to describe or talk about for the upper lid. When there's so much extra skin or the brow is so low that the extra skin lays upon the eyelashes. That's called lash ptosis, or actually can lead to visual field obstruction. In other words, it minimizes the images and the amount of light coming in to the eyeball itself. That's called visual field obstruction. Also, there's something called true ptosis, where the position of the upper eyelid itself is low enough so that it's blocking some of the pupil. And so, of course, that's another type of visual field obstruction, and people find that they sometimes mechanically lift up their eyelid and eyebrow when they're watching TV at night. Sometimes when they're driving, they feel they almost have to force the eyelid and eyebrow up. Sometimes people almost subconsciously learn to tilt their head back, bring their chin up, because the visual field is more clear or unobstructed below where the eyelid rests. So that's called true ptosis as opposed to lash ptosis. So what do we do about any of these signs of aging or visual field obstruction? As I said, please come into the office. I don't recommend that you plan out your own operation or call the office and schedule an upper blepharoplasty or call the office and schedule a lateral canthoplasty. Even if you've read extensively on Google, I think what you deserve is a custom designed approach. You deserve an exam. I think you should come in and be prepared to look in a mirror, point out to me what you want to change. And when you say you feel your eyes are tired looking, I'd like you to take a Q-tip, look in a mirror with me, look at your photographs, and point out what it is to you that brings about a tired looking eye. Is it pouches? Is it dark circles? Is it a prominent teardrop? Is it because your lower eyelid is at a lower position than you like it to be? Is there excess skin in your mind? Is your upper eyelid resting on the lashes? Or maybe it's your eyebrow that has descended. We've spoken a lot through the years, I should say. Actually has been years. I've been giving seminars about the triangle of beauty. And I have one of the corners of the triangle is related to volume. As we mature, we lose fat in the face and in the hands, and we gain weight in the trunk. That can happen in very subtle degrees in the temples and actually in the forehead. And there are actually fat pads, subcutaneous fat and submuscular fat under the eyebrow. So as that fat is lost, it's like lowering a tent pole. You know the kind of tent you will go camping with. If you lower the tent pole, it allows the canvas to kind of collapse and go lower. As we lose fat in the temple and in the forehead and underneath the eyebrows itself, that allows the eyebrows to come to a lower position. And as the eyebrows come to a lower position, it gives the illusion that there's lots of extra skin in the upper eyelid, where in reality is some of the skin has lost its resilience, and some can be trimmed, but sometimes we will want to revolumize, sometimes we will want to reposition the eyebrow, and that allows us to do a much more conservative upper eyelid blepharoplasty or eyelid tuck, leading to a much more natural, youthful, vibrant appearance. I'm very conservative when I address the fat compartments of the upper lid. I'm much more aggressive when I address the skin of the upper lid. And the converse is true for the lower lid. I'm very judicious, very careful when I address the skin of the lower lid. I'm much more likely to reposition, address, reshape, tailor, or remove some of the fat in the lower lid, or redistribute it across the eyelid cheek junction, or tighten up the lateral canthus. So that's an introduction to rejuvenation of the periorbital region, or relieving what many people call the tired look of their eyelids. If you'd like any more information about eyelid surgery, periorbital rejuvenation, giving yourself a more refreshed and vibrant look, I hope you'll call my office in beautiful Monterey, California, 831-646-8661, or go to my website, drmorwood.com, DRMORWOOD. Once again, this is the Doctor is In television program. Thank you very much for being here. Thank you, Michael Martins. Thank you for AMP Media Studios here in beautiful Monterey, California. Thanks very much for viewing.